Even as their infection rates from coronavirus started to fall, the Chinese clung to the security of their face masks. But across the globe, their use in public remains even now hotly disputed. Today, however, in England, it was announced face coverings will become mandatory on public transport from the 15th of June.
As passenger numbers increase, and we expect this trend to continue, we need to ensure every precaution is taken on buses, trains, aircraft and on ferries. With more people using transport, the evidence suggests that wearing face coverings offers some, albeit limited, protection against the spread of the virus. A face covering helps protect our fellow passengers. It's something that we can each do to help each other.
Mr Shapps said he was discussing the move with the devolved nations, although in Wales and Northern Ireland it remains voluntary, while in Scotland they are considering making it mandatory.
We haven't reached a final position on this, but I think it is fair to say it is something that we are considering.
This is face coverings as opposed to face masks. The government doesn't want critical supplies for health and care workers to run out. And the difference too is surgical masks offer protection to the doctor or nurse from the patient, while face coverings is as much about protecting others against you. And that is one of the government's primary reasons for introducing this, their concern over the number of people who are asymptomatic, who are carrying and spreading the virus without knowing it. This modelling graphic shows the difference wearing a face covering could make.
There's still going to be some virus particles that get out, some droplets that get out. But if for example, 70% of them get stopped on the way out, and then perhaps another 30% get stopped on the way in by the other person wearing the face covering, then that's an awful lot of viruses that are not being transmitted.
Professor Greenhalgh, who'd presented evidence to the government, said it had taken too long.
If they had brought in a policy, a much clearer, much firmer communication, the public would have much more confidence in this policy. We could have introduced it sooner, and I think personally that lives could have been saved.
There has been intense lobbying from London's mayor and the transport unions, who've lost dozens of their members to this virus. And there was a broad welcome from commuters tonight.
Where people are so close together and breathing on each other, and especially when people start to go back to work, I think it's an excellent idea.
I do it out of respect. I do think it's a good idea. My dad is elderly, and I think if he were to take the public transport, I would like people around him to take it as well. So
I'll get on the train, you've got couple with masks and more without. If they're worried about spreading this virus, make it compulsory. He should have made it compulsory in the beginning.
The World Health Organization, however, still does not recommend them, and some experts say they give a false sense of security, that people won't socially distance or carry on washing their hands. The government said tonight that people not wearing face coverings can be refused travel, and there may be fines.
Victoria MacDonald reporting. Well, now joining us now is Professor Liam Smith, a clinical epidemiologist from the London School of Hygiene and Tropical Medicine. Professor Smith, I mean, what is the value of these face coverings? Because the government's been arguing about it for about 5 weeks, and we seem to be really none the wiser as to whether they're any good or not.
Yes, I mean, the problem we've got is there isn't very clear scientific evidence. The evidence we have comes from much more ideal settings, clinical settings where we know the quality of the masks being used, the way they're being used is very ideal, and they do work, and that's why we use them in clinical settings. We've got very little evidence from everyday settings, and there are worries about them being used inconsistently, worries about people being complacent and forgetting other aspects of distancing. So it's not an easy question.
Well, then, I mean, how are people to judge this for themselves? Because actually wearing a face covering is a specific change for people. And some may be concerned that it actually doesn't improve their sort of survival rates at all.
I think there's some evidence that they're likely to be helpful. And I think this policy is welcome because it offers clarity. And as one of the guests said before, there's a lot of inconsistency. Some people wearing them, some people not. It's confusing for people. It offers clarity. I think it offers a lot of respect to the staff in the front line in places like shops, but particularly on transport and to fellow passengers. And there's no doubt that droplets do go less far if one's got one's face covered. So there's circumstantial evidence they're likely to be a benefit, and it does offer clarity, and I think it does offer some probable protection.
So in many ways, it is about protecting the people around you more than even protecting yourself.
Well, it's very much about protecting the people around you. The one thing a face covering can do is lessen the distance that droplets spread out from your nose and mouth. That we do know they can do. And that's a protection to the people around you, much, much more important than any protection to yourself. And people still need to try and adhere to social distancing, which can be difficult in enclosed spaces.
And do you think, in fact, you do need the force of law to ensure that they are worn?
I hope they will be worn. I think this is the kind of measure, and if we're going to defeat this virus, we need people united in an effort as a country. And everyone needs to play their part in defeating this virus. It's the only way we're going to get through, and we need clarity from the politicians on what people need to do. We need people to go along with that advice. Hopefully it doesn't need to be law. I would hope people will go along with it as part of a collective effort to defeat this virus, because it's the only way we're going to do it.
But very briefly, that acid question, the law.
It would seem a small thing to make an awful big fuss in the law about. I think there are far more important measures we could worry about in the law. I would hope people will comply with this, and I hope people will play their part in beating this virus without having to resort to the law.